Good afternoon, everyone. So today's class will be normal heart tracing of frog. Okay. So we'll know about the heart of the frog. Okay, and we'll be doing various stimulation, and we'll be giving the ionic part also on the heart. So we'll see the changes, how it responds. Okay. So what are the properties of the cardiac muscle? So the first one is automaticity. So what is automaticity? Yeah. So the heart has its own impulse or stimulation, okay, through which it normally produces electrical stimulation, okay, on the heart. So after that, various contraction and the relaxation procedure starts, okay. So it has its own electrical generation of stimuli, okay. Then the rhythmicity. So what is rhythmicity? Okay, so what is the reason behind that? The automaticity you understood, na? It has its own, like we have the humans, we have our own SNO, then the pacemaker system. So mainly this part, the automaticity, it depends on that pacemaker system, okay. It has its own electrical, like us. And what about the rhythmicity? What are the factors which controls the rhythmicity? So the innervation of nerves, the sympathetic and the parasympathetic activities, they mainly control this rhythmicity of the heart, okay. When the SNO will be producing the impulse, so if the sympathetic stimulation is more, then the sympathetic is what? What does sympathetic activity do? No, as a whole, what does a sympathetic activity? What do you mean by sympathetic activity? Yes. So in sympathetic activity, there is stress or fight, okay. Or in parasympathetic, it is normally at rest, okay. What are the changes we are going through in our body, okay. So in sympathetic stimulation, the heart rate is increased, okay. Normally in parasympathetic innervation or in parasympathetic stimulation, the heart rate is decreased, okay. So there is a balance, okay. With these two, the rhythmicity of the heart, it maintains it, okay. And what about the contractility? So the muscle of the heart, it is known as cardiac muscle. So the contractility mainly depends on the stimulation, okay. How much stimulation it is, the heart, from the SNO it is producing, okay, and the supply, okay, from SNO, then AV node, then the bundle of E's, okay. How the conduction system goes. So upon the basis it depends on the conducting system, okay. The more the stimulation, more the impulse from the what is that? From the conducting system, the more will be the contraction, okay. So it depends on that. What about the conductivity? The conductivity is the yes, that things, okay. So the conductivity will depend on the conducting system, okay. The SN node, the AV node, the conducting system, okay. That will depend on the conductivity, will depend on that, okay. What about extra systole and compensatory pause? What about extra systole? Okay, we'll come, okay. Okay, we'll discuss it. So this is the how does the heart of the frog looks like? Can anybody tell? 3 chambers. So what are the chambers? 2 atria and 1 ventricle. Okay. Okay. So in humans or in mammalians, there are 4 chambers, 2 atrium and 2 ventricles. But in case of frog, it is 2 atriums and 1 ventricle. Okay. So this part is like the oxygenation taking place. Okay. These are the pulmonary circulation. Okay. These are the alveolar system. Okay. where the exchange is taking place, okay, like the oxygenated blood from the lungs, okay, this part is the lungs, okay, so there the alveolar exchange is taking place, the gaseous exchange, okay, after oxygenation the blood is coming from the heart and then it is going into the system, and then deoxygenated blood is again returning to the atria, okay, then ventricles, and again it is the process continuing, okay. So here this is the picture, okay, this is the sinus venosus, okay. The sinus venosus is a triangular space where the two superior vena cava, the right and the left, and the inferior vena cava communicates, okay. This area is known as sinus venosus. Here the frog's pacemaker is located, okay. So here the frog's pacemaker is located. So this is the atrium, the true atrium, and this is the ventricle, okay. And these are the pulmonary veins, okay, these two, okay. This is the triangular space, okay. These are the two superior vena cavas and this is the inferior vena cava. Okay, so how will you prepare the experiment? So in previous slides or in previous experiments we have seen that we used to pit the frog from the brain and then we continue till the spinal cords, na? So here what we are doing is we are keeping the vagus nerve intact, okay. The vagus nerve, you know, it originates from the brain, okay. This is a which cranial nerve is vagus nerve? 10th, okay. So the vagus nerve is what type of cranial nerve? It is a parasympathetic, okay. So that is why we are keeping the brain, we are not pitting it here, okay. We are just pitting it from the spinal segment, okay. So the limbs will be paralyzed, okay, and the heart will be, the innervation will be there, okay. So after that we will dissect by keeping the frog in the supine position, okay. This is the supine position, and then we will dissect with the knife, okay. Not the knife, with the scissor, okay. With the scissor, then we will open the thoracic cavity, okay, into two parts, okay. We will fix the limbs, okay, of the heart, of the frog, okay. Then after that we will we'll put the heart in this position, okay. So the atrium will be facing downwards and the apex or the ventricles will be pointed upwards. We'll put the heart in this direction, okay, and then we'll fix with the screws or pins, okay, on the myograph board, okay. After that we will remove the pericardium of the heart, okay. What is the pericardium? What is the main function? Okay, so here we want to see how does the contraction and relaxation of the heart looks like on a graph, okay. So for that, if we remove the pericardium, okay, there is one fluid filled sac inside the pericardium that helps in lubrication, okay. So the main purpose of removing the pericardium is so that we can see the graphical representation more precisely. How does it on visualing, on our eye, on our naked eye, how does it shows, okay, the diagram. For that we are removing the pericardium, okay, this part, okay, and then we will pierce with the hook, okay. This hook we will pierce the mainly the muscular part of the heart. What is the muscular part of the heart known as? Yes. So we will pierce that part, okay, and we'll ensure that it doesn't puncture the ventricles, okay. If it's punctured the ventricles, then what will happen? Yeah. So we should ensure that it shouldn't puncture the ventricles, okay. We'll puncture the muscular part of the heart, okay. Then this hook, with the help of this hook, we will attach one elastic thread, okay, okay, and in this part, okay, we will fix it here. This is known as Starling's heart lever, okay. So in this case we are using this. Why? Because it has a spring, okay. How does it function? It has a spring, okay. It is in its normal position, but during contraction what will happen? The heart will contract, na. So when it will contract, it will pull the lever downwards, okay, and then on the smoked graph, the graph will be formed, okay. So when it will contract, it will go downwards, and when the heart will relax, it will again come to its original position, okay, with the help of this spring, okay. This is known as what? Starling heart lever, okay. Okay, this is the string, okay. The hook is piercing the this one heart here, and then with the help of the string we are tying it here, and when the heart will contract, it will pull, okay, and again it will come back to its original position. This one you know, na? This picture, okay. So how does the graph will look, okay? This is known as cardiogram, okay. So we will keep the kimogram at low speed, okay, 2.5 mm per second, okay. We will keep it there, and then we will start our experiment, okay. So how does it normally look? This is the from where the contraction is taking place, okay, the starting point. This is known as sinus venosus, okay. The sinus venosus is the pacemaker of the frog's heart, from where the impulse or the stimulation will be generated, okay. It will be followed by what? Systole and diastole. It will be atrial systole and then atrial diastole, okay. After that, when the impulse will be conducting towards the ventricles, what will happen? Atrial systole and then atrial diastole, okay. To right and left, superior vena cavas, and inferiorly by the inferior vena cava, okay. This is the triangular position. This is the pacemaker of the frog's heart, from which the impulse is generated, okay, like our, in case of humans, the SN node, okay. You can compare it with the SN node, okay. So here we can see the sinus activity, as I told. From here the systole, okay, will start, okay, the sinus venosus part, okay. The what is this? Atrial systole and then atrial diastole, okay. This is the systole and diastole. Again, for this is the ventricular activity, this is the ventricular systole and this is the ventricular diastole, okay. Why the during atrial systole the graph is a bit less than the ventricular activity? Because the contraction here, it is happening less, na. You saw now the size of the ventricle is very big, so it will there will be very much accumulation, na. The blood can be stored more, so the contraction will also be more, okay. So this is the reason why, okay. So after that, the same picture again, okay. Okay, the atrial activity, okay. From here it is started, from here it started, okay. Then the systole, then diastole, then again systole, then diastole, okay. Ventricular part, and this is the atrial part, okay. So this is a diagram, okay. So we will see now what is the effect of temperature. We have seen the effect of temperature on skeletal muscle, okay. So now we will see the effect of temperature on cardiac muscle of the frog, okay. On increasing the temperature, what will happen, okay. So we have to ensure that the temperature shouldn't cross 40 or to 43 degrees centigrade, okay. It shouldn't cross, okay. For increasing the temperature, in decreasing temperature, in decreased temperature, it shouldn't cross 10, okay. So what will happen if we give the temperature say for 37 or 38 degrees centigrade, what will happen on the conductivity? Okay, so there are terminologies before going to that, you have to know. So there are 4 terminologies which we are using in the cardiac muscle. The first one is chronotropic effect. Okay, what is chronotropic effect? Have you heard the term chronotropic, inotropic, dromotropic? Anybody heard? Okay, so what is chronotropic effect? Okay, chronotropic effect means what? When the heart will, the rate, okay, when the heart rate increases, or the term with which the heart rate is expressed, it is the chronotropic effect. Okay, when it will cause positive or negative chronotropic effect? When the heart rate will increase, or the conditions which causes the heart rate to increase, will tell those conditions as positive chronotropic effect, and the conditions or through which the chronotropic effect or the rate decreases, that will tell that those conditions as negative chronotropic effects. Okay, so this is the heart rate. Okay, and what is the inotropic effect? So the force of contraction. Okay, the force of contraction through which the heart contracts. Okay, if it is more, then we will tell it as an increased inotropic effect. Okay, and if it is decreased, the force of contraction of the heart, if it is decreased, then we will tell it as a negative inotropic effect. Okay, so what is rhythm? The other 2 terms are there, you have to know. Okay, like dromotropic effect, okay, venosus effect. There are other 2 terms also. Okay, where there is conduction. Okay, the conduction or the conductivity. Okay, the electrical how the stimulation is crosses from the SA node to the ventricles. Okay, so on which it depends, it is known as dromotropic. Okay, and another one is venosus. Okay, there is another term. Okay, on that another thing depends. Okay, you will know it. Okay, so now we will see what is the effect of heat on the first one was chronotropic. Okay, the second one was inotropic effect. Okay, the third one was dromotropic. Okay, the fourth one is venotropic. Okay, this is not a definition. Okay, it is the characteristic. Okay, of the heart. Okay, it depends on, I told na, the chronotropic one on which it depends, the heart rate. Okay, the inotropic one, the contraction, the force of contraction. Okay, the what is the third one? Dromotropic. It depends on the conduction, or how the conduction is going on in the tissues. Okay, the other one was venotropic. It is there. Okay, so we will see the effect of heat. Okay, what will be the effect of heat on the, if we increase the temperature? What is the solution we are using here? Previous Ringer's solution. So the Ringer's solution will increase the temperature to 37 to 30 degrees centigrade, then we will pour it slowly. Okay, so here will be some effect here. Okay, so what is happening when we are pouring the lactate Ringer's solution drop by drop on the cardiac muscle? What is happening here? There will be positive chronotropic and inotropic effect. Okay, so after that we will wait till the cardiograph comes to its normal, okay, position, and then we will pour the cold water. Okay, so on pouring the cold water, there will be decrease inotropic and chronotropic effect. So why it is happening? Why in increased temperature there is increased chronotropic and inotropic effect, and why in low temperature it is decreasing? Can anyone say? Why in increasing the temperature of the ringer solution there is positive chronotropic and inotropic, and why in decreasing the temperature why there is negative inotropic and chronotropic effect? One point is this one, okay?
Increase enzymatic and metabolic pathways, so increase ATP production, so higher amount of contractions.
So here when we will increase the temperature, there will be increasing the permeability of the membrane, okay? There will be increased permeability to sodium and calcium ions, okay? This will cause increased contraction and the rate will also increase, okay? And this will decrease the viscosity also, okay? In case of cold ringer solution, the reverse will happen, okay? So it will decrease the permeability, okay, and the viscosity will also increase, okay? Okay. So see how on heat the contraction is increasing, okay, and the rate is increasing, and on application of the cold, what is happening? The contraction is decreasing and the rate is also decreasing. Understood now? So this is the graph, okay? You will get it on your book, okay? In occasion it is there, okay? So this is the atrial systole and this is the atrial diastole, okay? And this is the ventricular systole, this is the ventricular diastole. So now you should be knowing why in atrial systole the graph is a bit less compared to the ventricular systole and diastole, okay? So here we are seeing that on increasing the temperature, the rate is increasing, contraction is also increasing, okay? In case of cold, the rate is decreasing, okay? The contraction is also decreasing, okay? So this is another graph showing what is the effect of adrenaline. So what type of neurotransmitter is adrenaline? So this will be released in where? When will it be released? Normally fight or flight, okay? In those conditions it will be released. So it is a type of sympathetic, okay? It will be released when the sympathetic activity will be activated, okay? So now what will be the effect on heart? Okay, so what is the effect you are seeing here? When we are giving adrenaline on the frog's heart, then what is this? This is the force of contraction, okay? The force of contraction is increasing along with the rate. You can see, okay, this increasing to a certain level, and then when the dose of the drug is, the effect is diminishing, getting reduced. So then it is again coming back to its normal graph, okay? Then after that we are giving one more drug, okay, to see what the effect of acetylcholine. What type of drug is acetylcholine? What type of neurotransmitter? Inhibitory. So it is a type of parasympathetic, okay? So what will happen if we give acetylcholine on the heart? What is happening here? The rate of contraction is getting decreased, na? We can see, and the rate is also decreasing, na? You can see, na? This slowing down. So on application of acetylcholine, so one thing is here, okay? On application of acetylcholine, what will happen, okay? So this will cause activation of the potassium channels, okay? It will cause potassium to release. Mainly it will cause increased depolarization, okay? Increased repolarization, okay? So what will happen after that? it will come to rest. Okay, the more the repolarization or after repolarization state, the muscle is going back to its resting state, so it will take more time na. So as a result, the muscle won't be able to come to its contracting phase, okay, or the systolic phase. So what will happen now? The heart will stop at diastole. Okay, what is happening here? When you are giving the acetylcholine, this is a inhibitory. It will have inhibitory effect on the heart. Okay, then it will cause what? The after polarization phase, after repolarization phase will be increased here. Okay, then it will cause potassium to efflux. Okay, so this will it will relax it more. Okay, then the heart will stop at diastole if we give excess acetylcholine here. Okay, excess. Okay, I am using the term here excess. Okay, if we give it, it will stop at diastole. Understood? So after a certain time, okay, it will again, when the effect will be over, it will again come back to its normal rhythm and contraction, okay, and relaxation. Okay, see, we can see now this coming back again to its normal function. One more thing is there. Okay, the effect of some ions. Okay, so here we will be seeing the effect of calcium chloride, okay, and the effect of potassium chloride. Okay, so here the effect of, what will be the effect of calcium chloride on the heart muscle? So what normally will happen? Okay, so normally there will be more. What will happen during depolarization? There will be more contraction. We have seen from previous classes. Okay, there will be more contraction. So till a certain point there will be contraction. Okay, but if we pour it continuously, what will happen? One term was there na, contraction remainder. What was there happening? So there will be sustained level of contraction. Okay, okay, yeah. So it will cause systolic failure. It is having sustained level of contraction. Okay, so now the heart is not being able to relax due to excess calcium. The heart won't be able to relax and come to its original. Okay, then what will happen? There will be it will be in a systolic failure. Yes, systolic failure. Okay, so the heart will stop at systolic failure. So this will be the effect of calcium. Okay, so what will the effect of potassium chloride on the heart muscle? Okay. So what normally potassium does, when we have seen in the action potential na, what, in which phase the potassium in repolarization phase or in the relaxation phase. Okay, we are seeing that the effect of potassium. Okay, so there what is happening? It is helping in relaxing phase na. So in diastolic phase it is helping. So what will happen if there is excess? So it won't be able to get contracted. So there will be hyper repolarization. Then what will happen? It won't be able to contract. So it will be diastolic. Diastolic or systolic? Diastolic. So it will stop at diastole. Understood the basic concept? So one more ionic mechanism is there. What will happen if you give sodium ions? Suppose sodium chloride. Okay, what will happen if you give sodium chloride? This is not given here, so I will tell you. Okay, so see, the acetylcholine part is completed. Okay, in case of calcium ion, calcium chloride, so what is happening? It is going to a calcium rigor. Okay, due to excess calcium. Okay, it will unable to diastole. Okay, it will be in a contracted phase. Okay, so the heart will stop at systole. Okay, so here there is no heartbeat, so this is asystole. So here the heart is stopped. So the heart here it stopped. Okay, so when the effect will get over, again it is coming back to the its own rhythm. Okay, so see what is happening during calcium chloride. It is, so if we consider this as systole and this as diastole, okay, the contraction is happening here and the relaxation is happening here. So it will be going in hyper repolarization phase and then it won't be able to contract. Okay, the same thing. So it is, the heart is stopping at diastole. Simple reason. Okay. Hyper repolarization. Depolarization. What is the phases of the action potential?
Depolarization.
So what is the after repolarization phase? Do you know? Hyper repolarization phase. So there what is happening? The potassium is increasing now, more it is, the intracellular part is getting more negative. Okay, so what will happen at that time? The heart won't be able to contract. It will be in a sustained relaxed state, so it won't be able to constrict. Okay, so at that time what will happen? It will fail in the diastole. So the systolic part, it won't come to the systolic part. Okay, so I was telling about the sodium chloride. Okay, what will happen if we pour sodium chloride solution on the frog's heart? Excess sodium chloride solution on the frog's heart. What will happen? Can anybody? Okay, contraction will be more. Okay, first the contraction will be more, the rate will also increase. So after that what will happen? So what the sodium ion does is it interferes in the calcium ion. Okay, it interferes in the calcium ion efflux. Okay, now the influx, the mainly the contraction and the relaxation part, it interferes in the calcium ion. So in that mechanism it fails in the diastole. Okay, so during sodium ion it will depolarize, so the systole will be more. Okay, but when it will be interfering in the calcium ion exchange, okay, that time it will be failing in the diastolic part. Okay, why? Because what the calcium ion is doing, I told na, systolic. Okay, so by the interference it will fail in the diastole. Okay, it won't be able to contract properly. Okay, so another one is there. What will happen if we give vagal stimulus continuously? Sodium ion. Sodium ion told na. So I told na what are the ions which is responsible for mainly the contraction or the systolic part? Which sodium and calcium ions. So sodium, what will it do? At first it will increase. It will increase the rate of contraction. Systole is happening. Okay, fine. But it also needs to get relaxed. Na? So what it does is sodium ion also interferes in the calcium ion exchanging. Okay, when the efflux will be taking place. Okay, after the what is that? Depolarization. It will come to a repolarization phase. But it will interfere in the calcium ion exchange. So what will it do indirectly is it won't be able to relax. Na? It won't be able to relax. So it will fall. Na? So at diastole it won't be. Contraction phase is going. Na? The calcium ion is unable to perform that function as it is interfering. So at diastole it will fail. Okay. So here another diagram is there. It is showing what is the effect if we give vagal stimulation continuously. So as I told, so you have to know the innervation also. Okay, the atrium, the electrical conducting system, okay, and the ventricles. What are the nerves which are supplying? You have to know that also. Okay, the atrium, the electrical conducting system, those are supplied by both the sympathetic and the parasympathetic nerves. Okay, the ventricle is the only part which is not supplied by the parasympathetic. It is supplied by the sympathetic, okay, but not by the parasympathetic. So what will happen if we continuously stimulate the vagus? So if we continuously stimulate the vagus, as we know, the vagus has its inhibitory action. Okay, so it will cause inhibition of the first at the pacemaker. Okay, normally the electrical stimulation or the generation is happening from the SN of the pacemaker. So if you give inhibitory action here, so there won't be production of the impulse. Okay, so it won't conduct to the heart. So there, what will happen? There will be a straight line or a phase of asystole, where there will be no contraction, no relaxation. Okay, so but after some time we are giving, okay, from here till here we are giving the stimulation of the vagus nerve, but after certain period of time we are seeing some generation of impulse or contraction and relaxation. Okay, here. Why this is happening? So when the impulse will be generated from the pacemaker, the sympathetic activity will have its positive inotropic and chronotropic effect, but the vagus nerve is what will that have is negative effect, na? So this will reduce and there is a balance. As a result, we are getting the heart rate of frog is around 25. Okay, so why we are getting that heart rate? So if we cut the parasympathetic innervation, what will happen? The heart rate will increase. There is one positive effect of inotropic and chronotropic effect. What if we cut the sympathetic innervation? The heart rate will more decrease, na? So if we cut the parasympathetic nerve innervation, the heart rate will increase. Suppose it will go to 75, okay, or 65, it will touch. Okay, if you cut the sympathetic innervation, the heart rate will further reduce. It will go to suppose say 5 or 10. Okay, so the same thing is happening. So here we are only stimulating the vagal nerve, but the vagal nerve is only supplying the which part? Atriums, the conducting system, but not the ventricles. Okay, so the electrical or the conducting system has its own, I told na, has its own capacity. Rhythmicity, the first point, has its own capacity to generate impulse. So what will happen? After some time, it will generate its own impulse from the rest of the conducting system. Okay, so the sympathetic activity will take place here. The parasympathetic effect is going on, but the heart is unable to pump now. So after certain period of time, what will happen? The sympathetic activity will take over, and then the heart will start pumping. Why? Because the parasympathetic effect is not present in the ventricles, na? So if this is the systole, atrial systole and diastole, this is the ventricular systole and diastole, na? So this is the ventricular activity, not the atrial. Why not the atrial? Why ventricular? Understood? So this is also known as vagal escape. Okay, so it is given in the book nicely. Okay, so suppose if you are giving a stimulus, okay, suppose when normally the heart is beating from the pacemaker, it is the contracting system is continuing with the contracting system. Okay, so first it will systole and then it will diastole. Okay, so a contraction should be followed by relaxation. Okay, but if you are giving a second stimulus, okay, what will happen? There will be premature contraction. Okay, when the heart is contracting, then it will be followed by relaxation. But if you are giving the impulse in between, suppose say 25, I told 25 beats per minute. So if you are giving a certain impulse in between those, okay, beats per minute, it will cause sudden contraction. So this is known as extra systole. Okay, on extra systole is happening. So during the third impulse, okay, the normally when the impulse will be again generated, at that time there will be a straight line. Why straight line? Again, it is a part of action potential, the refractory period. Okay, in that what we have seen in the refractory period, there is absolute refractory period and there is relative refractory period. So if it falls in the relative absolute refractory period, there will be no action potential generated. So similar thing will be happening here. Okay, so the extra systole is that, you understood? Okay, so what will happen after that phase where there will be no conduction or no systole and diastole? After that again the heart will start. Okay, so for the on the fourth beat, the heart, there will be conduction. The third conduction will be non-responsive. Okay, why? Because of that refractory period. Okay, so there is conduction. There was one point, if you have written or seen. Okay, conduction gap or something was there, na? Conduction vacancy, I think. Okay, the first point which I have told you in the, you have understood now, and the refractory period also you have understood now. Okay, if you are giving the stimulus in between the two beats, so that time there will be an extra systole. Okay, after that during the third stimulation, the heart won't contract. Why? It is falling under the refractory period. Okay, in this phase, the heart will be in a straight line. There will be no contraction, no relaxation. Okay, after that, see the heart, there is stoppage now. Stoppage of the heart. The heart stop. So now when the fourth impulse will be coming from the SN node or the pacemaker, that time again the heart will start beating. This is the reason. Okay, so what is vagal escape? You understood na? Anyone tell? Stand and tell. What is vagal escape? Tumi bolo. Who understood? You understood? You try. No need to worry. You try. We are having a discussion. Okay. I am telling you. I am making sure that you should understand this one. Okay. That is why I am explaining. Anybody understood from here? Vagal escape. So here, similar way. Stimulus of the vagus nerve at higher strength and frequency. So same. Here we are starting the stimulation. So here there is no impulse generation. So here what is happening? The heart is stopping. Okay, temporarily. So after certain time we are seeing there is a vagal escape. Na? So it is resuming the impulse for the survival of the heart. Okay. So after some time when the effect is reduced, again it is resuming to the original. So this is the actual graph. Okay, so 4 to 5 graphs at least it will take. Okay, beat it will take to resume, and then it will resume to its original rate and contraction phase.